Hi everyone. So today onwards we are going to start our normal classes. So your class is going to be finished around mid of the June, 15 to 20 June. Some of you was asking to me personal message, so I'm just announcing here because almost 85% the syllabus already covered. It's like 15% only left, 12 to 15%. So now regularly we will take the classes, we will finish, then we will have around 1 month for only for the revision. Okay. And secondly, the new batch for November, we are going to start from 1st of November, 1st of 2nd. We will let you know about that batch. But today is here. Basically, this is like a quiz for you. So there is a 3 lucky winners also will get some reward in this class. This is like it's going to be a fun class today. So there's our faculties is here. Kamar, are you here?
Yes, sir, I'm here.
Yeah. So Kamar is going to take class today and Kizia. So they have some questions. So you have to give the answers, as soon as possible. So there will be a surprise gift for those are top 3 students. Kamar will give some instruction maybe later on about this. Okay. And yeah, tomorrow we have one class for you, regular class, and Sunday have one class. But next Wednesday onwards, whatever your timetable earlier onwards, we will follow the same. So Sunday we have one class 7 to 9, not 2 lecture, only 1 lecture on Sunday. Saturday 1 lecture, Sunday 1 lecture, then Wednesday onwards will be the normal. Okay.
Shall I start with? I want to give some announcement.
Yes, you can give some instruction. Kamar is here. He is your lecturer. So he is around. He is basically my senior in the teaching. When I even we were basically both was teaching in the Malaysia. So basically he is a BCPS qualified lecturer. So you might be in your life you never meet or seen any BCPS. I don't know in my life apart from Kamar. In my group I have maybe hundreds of lecturers. They are PhD holders, postdoc holders, but none of them are BCPS qualified. So Kamar only I know. Some of my classmates, some friends, they tried, but they failed. Even Kamar also know some of them.
Okay, thank you, Dr.
Yeah,
Akram.
yes, Kamar, you can start. So Kedia also on the lecture with us, and Nancy also is here, I think. And we also is trying to have 2, 3 more lectures because there are so many students joining us. We are going to have multiple sections for other batches. But for you, July, no impact on your classes. We are going to start tomorrow onwards regular classes. Yes, Kamar.
Okay. Okay, thank you, Dr. Akram. And first of all, I would like to greet everyone. Good afternoon, good evening, and good morning. Actually, the time difference, I do not say in
Yes.
some country there will be the morning, some will be the afternoon, and some of the evening. Okay, today we are going to have the interactive session, and we are going to conduct one quiz through online platform, and there will be 3 surprise gifts which will be given by the academically that later the Dr. Akram will announce to you, and there will be some surprise gift for you, those who getting the higher marks, those who get the top scorer. So just I want to give some how the top scorer will get it. The first, who will get the most number of the correct answer, and second one, who is going to give the more quick answer. It's just like a buzzer. If you have seen in some programs that they have the buzzer option, those who have click and tick on the buzzer quickly, they have to answer first. Here also, those any student who answer first, they will get the more score. As long as if both have given the correct answer, but the one who have given the most quick answer, they will get the highest mark. The software, the platform will automatically detect. They will detect that who has given the very first response and who have given the second response, and they will give the score accordingly. So may I know everyone is ready?
Everyone has a laptop plus phone.
I believe I can see a few people who have joined from their mobile phones. It is a reminder that if people can utilize 2 devices, one being the laptop and other being the mobile phone, that will be easier for them to get things rolling.
Yeah. If you have the 2 devices, I will recommend you use the 2 one, because on this device, on your main screen, the Google Meet, you can see the question, and you have to answer through the second device. It will be more convenient for you. You can use the same device also, but you will getting the delay in replying the answer. So those who have the two device, they can answer more quickly as compared to the one if you are using only the one device. So may I know that most of them, do you have the two devices? Because once we start the quiz, we cannot stop, and no one can join in between that quiz. So before we start, we want to make
I think
ensure
we
that
can wait 1 or 2 more.
There is a timing factor as well. The quicker
Yes.
you answer, the higher points you will get. सही जवाब प्लस कितना जल्दी आंसर कर पा रहे हो आप लोग.
There is a chance for $151 for first prize, second 101, $100 one, and 51 for third. So this is today is the chance for you to win. Okay, so try to give quick answer if you can.
Let's start. It's the 30 seconds are over. I guess we are good to go. We need to provide the game pin right now.
okay, and I will provide you with just.
This is the game pin, or maybe if you can scan also, so you can go on the same page.
Okay, let's start.
Good luck, guys.
Okay, your question number 1. You can see from the screen which of the following autoimmune disease is related to the thyroid gland. Okay, the correct answer was Graves' disease. Those who have corrected answered, 77 students have the correct answer. Remaining, this one is wrong. And let's see who is the first. Okay, Purvi. She is the one, he or she, I don't know. She is the one who has given the quick
Purvi.
answer. Okay, we move to second question. Which of the following routes of administration would be subject to first pass metabolism in liver?
Yes, 103.
5 seconds left.
Yeah.
Okay, 65 got the correct answer. And let's see who is that. Okay, that's great. Harika goes to number 1.
Harika and Purvi again.
And the Purvi is second one. And the third one is Sonu. Let's move to the next question. Which of the following antihypertensive agent is most similar in chemical structure to hydrochlorothiazide? Okay, that ends. 17 students got the correct answer. And let's see the scoreboard. Okay, that's great, Sonu.
Oh no, number 1.
From third position is jumped to first.
Okay, let's move to the next question. Question number 4 is the intensity of pharmacological action of drug is most dependent on the 5 seconds left. 2, 1. Okay, 47 students got the correct answer. And let's see the scoreboard. Okay, that's great. Sonu is still
Oh
in the.
no, Sonu was Sambala's competition high. Manju.
Okay, Sonu, Sumbal, and Manju. And let's move to the next question. How many tablets of 500 milligram SP need to be crushed to produce a 250 ml suspension of aspirin containing 500 milligram per 10 ml? 4 seconds, 3 seconds. Okay, 25 got the correct answer. Okay, Sonu is still in the number 1. Let's move to
Sonu is running away with the game.
glycoprotein is a protein linked to a okay, most of them got the correct answer 71. Oh, not the correct answer. 13 got the correct answer. Okay, Sonu, Abdul Hanan, and Hassan, they are the top 3 now. Next question. Adverse reactions of atropine include all of the following except. Okay, that's correct. 47 got the correct answer. And see the scoreboard. Okay, Sonu and Hassan, Subal is the top 3, followed by Harika and Manju. That's great. Still, you have the time. You have the chance to increase your ranking. Let's move to the next question. The CNS and respiratory depression due to morphine overdose can be reversed by. Okay, that's great. 70 students, they got the correct answer. Let's go to the scoreboard. Okay, Sonu, Hassan, and
Sonu is still is the number 1.
Okay,
Hassan,
Hassan is moving to the higher place and he have given continuously 6 correct answer. That's great. Hassan on fire. Let's see and move to the next question. Okay. A basic principle of drug absorption is that a drug is usually not absorbed. Okay, 68 they got the correct answer. Let's see the scoreboard. Okay, that's great.
Sonu 7th constantly in Hassan. Harika, Keshav.
Anusha is making coming back with 3 in a row. That's great. You still have time, chance. Next question. Nicotine acid and gemfibrozil are used to treat. Okay, 60 students got the correct answer. Let's see the scoreboard. Okay, Sonu, Harika, and
Hassan,
Hassan, Sumbul,
Sumbul,
and
Palak.
let's move to the next question. Question number 11. Which organ in the body has a major contribution to the development of the immune system? That's great. 67 got the correct answer. Scoreboard. Okay, the same position. Let's move to the next one. Question number 12. The mechanism of action of insulin glargine is. 10 seconds. Okay, only 10 got the correct answer. And Sonu, Harika, Sumbal, Aswan, and Anshu. Next question. Drugs used for the treatment of bipolar disorder except. So did you got the correct answer? Let's see the score. Maybe this will change some scoring. Okay. The first four are the same and Bhavika came on the number 5. Next question on your screen. Maximum dose of aspirin. Okay, 18 got the correct answer. Let's see. We move to the scoreboard. Okay, Bhavika jumped to the third place now. Sonu is still on the first place. Harika and Bhavika. Next question on your screen right now. Levodopa and carbidopa is given in the ratio of. Okay, that's great. 34 got the correct answer. And let's move to scoreboard and see. Okay, the first 3, 4 are on the same place, and Hakim Kareem came on the 5th place. Good job. Next question on your screen. Urticaria that appears rapidly after the ingestion of food usually indicate which type of hypersensitivity reaction? Five seconds left. Okay, that's great. 44 got the correct answer. Let's move to the scoreboard. Okay, the first 4 is the same. Hakim kept the 4th place. Repeater is on the 5th place. Next question on your screen. 3 questions left. Atropine causes. Seconds left. Okay, 49 got the correct answer. Let's move the scoreboard. Okay, that's great. The first 3 toppers, that's great. They're doing a good job. Sonu, Harika, and Sumbal. And the 4th one, that's a good one. They have improved the position, and Bhavika. Okay, your 18th question on your screen. A vial of epinephrine at 1 into 1000 weight by volume is equivalent to how many milligram per ml? Okay, that's great. 48 got the correct answer. Okay, 2 students came up by Aston and Siri. Your 19th question, which one of the following drugs can exacerbate a patient to develop the acute gout? 2 seconds. Okay, 31 got the correct answer. Okay, Sonu, Harika, and Hassan in the top 3. Now this is the last question. And this last question will decide who will be first top 3. So there will be the more chance from these 4 or 5 students. The last question on your screen, the maximum dose of acarbose is. Okay, that's the end. 23 got the correct answer. Let's move to the scoreboard. Let's see in the podium. Third place, SN. Congratulations.
Congratulations, Hassan.
Yes, Harika.
Harika number 2.
Guys, if you can show up
And-
on your on the camera as well, it will be great.
Okay, that's great. We clap for
Yes.
this. And other 4
Sonu
are
is the
runner
number
up.
1.
The first is the Sonu, second is the Harika, and third is SN. Can we see the students who are there?
Yes, can you please on your camera? Who these 3? Sonu, Harika, SN.
Sonu here. Sonu, okay, that's good. Congratulations, Sonu.
Where is Sonu?
Second, Harika. Who is Harika?
Sonu, hi
Congratulations,
Sonu.
guys.
Congratulations.
Thank you, sir. But what is
Okay, and next is the Harika. Where is Harika? Can you please on your camera?
Okay, congratulations, Harika. Harika here. I can see now. That's great.
Okay.
Harika, you are the second place.
Great
Third
job.
one,
And SN.
SN. Can we see the SN? Who's the SN?
Okay, and thank you so much. Congratulations, everyone. So the academic counselor will get back to you. So for your gift. Okay.
Okay, how we
Now-
can think Mohsin SN is the same person? Is it? Are you the
Yes. Mosan saying he's SN.
Okay.
Okay, no problem. Siddharth can probably
Get in touch. Yeah. So now Kamar and Kezia can give the explanation of these questions. So Arindam, we can leave. Yeah. Thank you so much and congratulations. And tomorrow onward there will be a normal class for you. Okay, 7 to 9.
Okay, may I know, can you see the screen?
yes, visible.
Yes, sir.
Okay. Okay, first I will hand over to the Kezia. She will explain first about the first few questions, and in between, if you have any question, maybe you can ask at the end. Okay, now I hand over to the Kezia. So I will handle the slides. Once we move to the next one, you can inform me. Yes, Kezia, please.
Thank you so much, Kama. Kama, actually, I can share my screen. Hello, guys. I'm so sorry. I think I joined a little bit late. I am Kezia. Currently, I am in Australia. I have started my internship here. I have cleared my CAPS exam 2 times in 2019 and then again in 2022 July. So, guys, don't overestimate who are the winners and don't underestimate who are not the winners. Okay, so you have to keep on going with your preparations, and we can just discuss the questions. I would really switch on your videos if you can, if there is nothing related to your data problems and all that. So, is my screen visible to all? Okay, so the first question was, which of the following is an autoimmune disease and is related to thyroid gland? First of all, I hope every one of you knows what are autoimmune diseases. So first thing is, out of these 4, what do you think? Are all of these autoimmune diseases?
No, all are not. All are not autoimmune diseases.
Which one is not? Which one is
Parkinson,
not autoimmune disease?
Parkinson is not.
Exactly. Parkinson is not
Epilepsy is
autoimmune disease.
autoimmune disease. Crohn and Rich.
Yeah. Addison disease is a autoimmune disease and it is related to adrenal glands. Yeah, when the body produces such antibodies which start destroying adrenal glands, and adrenal gland is unable to produce the hormones. It is also called as adrenal insufficiency. So Addison disease is autoimmune disease. Then comes the Graves disease. In Graves disease, what is happening? There is hyperthyroidism. Thyroid gland is producing excess of thyroid hormones. So this is also an autoimmune disease. What is happening in this? Body is producing antibodies which are which get attached to the thyroid stimulating receptors, and as a result there are more thyroid production, more thyroid hormone production. Then the third one is Crohn's disease. Crohn's disease is also said to be an autoimmune disease. It is inflammation of the inner bowel. So it is also called as chronic bowel inflammatory disease. Is it fine? And you all know Parkinson's disease. It is not an autoimmune disease. It occurs due to destruction of our nerve cells in substantia nigra of the brain. So basically what is happening in Parkinson's disease, there is destruction of dopamine producing cells. So that's why we have to get dopamine from outside. You also got a question related to this carbidopa and levodopa, yeah? That is used in Parkinson's disease. Clear? Is there, if you have any doubt regarding all these 4 options, you can ask.
It's clear, ma'am.
Okay. The next one is, which of the following routes of administration would be subject to first pass metabolism in liver? You all know when whichever drug goes into first pass metabolism through liver, it is absorbed and only some amount of it is available for showing the drug action. Yeah, some of it is absorbed to show the drug action and other is excreted. So only the oral is the route among these where the drug is subject to first pass metabolism. We take IV injections just to reduce the first pass, yeah, or to escape the first pass. So IV is directly injection into the veins. Inhalation is we are inhaling through the nose and the drug is going directly into the site of the action, that is the our pulmonary veins and bronchi, lungs, etc., or nose. So all the drugs which have to show the action in the nose or the lungs, we take through IV, so that there also it is the first pass metabolism through liver is bypassed. Sublingual. Any drug which we take sublingually? Can anyone? Anything?
Nitroglycerin.
Corporate.
Sorry, so nitrates, yeah, to prevent the anginal attacks. We take it, the heart-shaped tablets, just to prevent the anginal attacks, so that they are absorbed sublingually. There is no first pass metabolism and the drug action is shown at the earliest possible. Clear? Anything you want to ask? Coming to the third one, which of the following antihypertensive agent is most similar in chemical structure to hydrochlorothiazide? So for chemistry part, you don't need to remember all the structures from KAPS point of view. You just need to like broadly know that what kind of structure it is. You don't need to exactly know that at this number there was hydroxyl group, at 4th number there was a ketone group. No, not like this. Just like the broadly, you should know the class. Like, is there a benzene ring or it's an open chain? Is what type of compound is it? We will go through it. So which type of hypertensive? So first thing is hydrochlorothiazide. It is having benzothiazine ring, and same is with diazoxide. Two, I'll show you the structures. This is hydrochlorothiazide. Yeah, this is benzothiazepine ring, and same ring is present in diazoxide. Whereas hydralazine, methyl dopa, and reserpine, they are completely different. So this was an easy guess, guys. This was not that difficult. And I hope you know all of the drugs. You are hydrochlorothiazide. This is a diuretic. Hydralazine is again an antihypertensive agent. Methyl dopa is also an antihypertensive agent used, which acts centrally. Yeah. And then reserpine is also an antihypertensive agent, and diazoxide is also. All of these are antihypertensive agents, but they work through different mechanism of actions. Done? So you don't need to remember completely the structure. You just need to like know the category of the drugs, that it is having a sulfur and nitrogen ring, and hydrochlorothiazide is also having a sulfur and nitrogen ring. You can see no other structure is having such ring. I'm so sorry. Right. Done? Then coming to the next question, the intensity of pharmacological action of the drug is most dependent on. First, have you understood the question? It says the intensity of pharmacological action, like how much of pharmacological action you are getting. It's not about when you are getting, when is related to onset of time. It is not asking about. It is not about efficacy, like how it will be. It is just intensity. Whatever the pharmacological action is coming out, when it will be at highest, who is going to decide that? Suppose a action has to come through the receptors, and there are 10 receptors. When the action will be at its maximum, of course, when all the 10 receptors are occupied. Correct? So when all the receptors will be occupied, when the concentration of the drug will be maximum at the receptor site, the drug has to reach at the receptor to give the action here. So the answer is when concentration of the drug at the receptor side is maximum, the intensity will be maximum. So the intensity is dependent on concentration of the drug at receptor site. Whereas T half of the drug, T half of the drug doesn't determine intensity of the action. It is just that when the half of the drug will be excreted from the body. It has nothing to do with intensity. Onset time of the drug, it only tells you about when you will get the action, how quickly you will get the action. Minimum effective concentration, how much minimum of a drug is required to get the pharmacological action, not to maximum, not to get the maximum action, just to get the action. Is there any doubt with these options? Anyone thinking, no, this should not be the right answer? I'm feeling like I'm speaking alone. Is it clear? What's not clear, you can ask me. All right. If there is any doubt, you can ask. Okay, this is done. The next question, yeah? Someone wants to ask something? Next, 500 milligram aspirin. Now, one tablet is 500 milligram, needs to be crushed to produce a 2 aspirin containing 500 milligram per nanometer. During the quiz, it was written 25. Sorry, what was written? Yeah, here it was written 250 ml of suspension. Yeah. So if you get 250, sometimes it happens. In CAPS exam, you get a calculation. It was a typing error anyhow. But sometime in CAPS exam also, you will see that I am not getting whatever answer you are getting. The exact answer is not in the option. So if I go as per 250 ml, the answer will be 25. So there is no option of 25. So then also you have to select the closest one, right? So the first point is if you were doing with 250, then also the answer will be same 20, because you have to select the closest one, and it happens in CAPS as well. Sometimes we don't get the exact answer in the options, so we have to select the closest one. So if I go with 20, so do you know, have you done the calculations? You don't know, or you want me to do this? Hello.
Ma'am, please solve this.
Yeah, I'll do this, but first I will just want to tell you a trick. See, 10 ml, 500 milligram means 500 milligram is one tablet. Yeah, just an easy way. 10 ml contains one tablet. 200 ml should contain. Okay, 10 ml contains one tablet. 10 is equals to 1. 100 will be equal to 10. If 10 ml contains one tablet, 100 ml will contain 10 tablets, and 200 ml will contain 20 tablets. It was that simple. But if you want to calculate, we can calculate as well. Just 1 minute. I will share the whiteboard. Just 1 minute, guys. I don't know. I think it needs someone to allow me to use the whiteboard. It's okay. My slides are visible to you.
Siddharth is here, I guess. Siddharth, if you can check.
Yes, allow me
Okay,
15 minutes.
I can do. It's okay, Siddharth. I can do here. Not a big deal. So the question was, one aspirin tablet contains 500 milligram of drug, and we need to make a suspension of 200 ml. 200 ml suspension is needed, yeah, which having concentration of 500 milligrams in 10 ml. It means if it contains 10 in 10 ml, there is 500 milligrams. So in 200, in I don't know, like you do you use the unitary method? I use the unitary method. It will be easy. 10 ml is equals to 500 milligrams. 1 ml will be equal to, how you do, 500 divided by 10, and 200 ml will be equal to how much? I'm just telling you very basic. And multiplied by 200. We do this way. Can you calculate this? For 10 ml, we need 500 milligram of aspirin because the concentration in the question is 500 milligrams per 10 ml. For 10 ml, we need 500 milligrams. This is called unitary method. For 1 ml, we will need 500 by 10. And for 200 ml, we will need 500 by 10 into 200. So what will be the answer? How much aspirin do we need total? Can you calculate?
20.
No. How 20? I'm asking about how much of aspirin is needed for total 200 ml.
Ma'am, 10,000 mg.
Yeah, 10,000 mg. Yeah. So we need a total of 10,000 mg. So now 500 mg aspirin corresponds to one tablet. Yeah. 1 mg of aspirin will correspond to 1 by 500. And what we need, 10,000. 10,000 will correspond to 1 by 500 multiplied by 10,000. What we need. How much it will be? Calculate. Just 10,000 by 500.
Now 20.
20, ma'am.
Yeah. Got it? Is it clear? Some people, they don't write this 1 ml, 1 mg and 1 ml they don't write this, but I write this because this is unitary method. We have been doing this since our 5th, 6th class. So it is easy. You don't need to grasp or remember or do ratification of any formula. This is very basic. We used to do in our mathematics in 5th, 6th class, like 10 chocolates cost this much, 1 chocolate will cost this much. How much will be the cost of 2 chocolates, if you remember. So you don't need to remember any formula. This is just basic. Is it clear? If anything is not clear, you can ask. If anything is not clear, you can ask. Is it clear?
Clear, ma'am.
Yes, ma'am.
Okay, done. So next, I was not happy with this answers. I don't know why. I think the least was this, like least number of students answered correctly in this question. The question was glycoprotein is a protein linked to. Guys, glycoprotein. Protein is protein and glyco is glycogen. What is glycogen? Carbohydrate, glyco, gluco. These words are given for carbohydrates only. So it was easy. Okay. So glycoprotein is a protein linked to carbohydrate. Can someone give me any example of glycoprotein? Where are glycoproteins? Any example of glycoprotein? Like, why are we studying glycoprotein in pharmacy? Yeah. Anything related to glycoprotein coming in your mind?
Type of receptor.
Insulin?
Yeah, correct. Yeah, insulin. What else? All the antibodies, the virus and bacteria's outer bodies, they are all form of glycoproteins. In our cell membrane, the pores are formed for absorption of something. They are of glycoproteins. Yeah. So all these are glycoproteins. So nucleotides. Do you know nucleotides? Have you ever heard of this?
Yes. DNA,
What is it?
RNA.
Yeah,
DNA,
DNA,
RNA.
RNA are comprised of they are nucleic acids and they are made up of nucleotides. Yeah. So it is basically nucleotide is formed of what? There are 3 parts of nucleotide. Like glycoprotein is made up of a carbohydrate and a protein, and nucleotide is made up of 3 parts. What are those 3? Hurry up. Okay, it's a pentose sugar, a nitrogenous base. Nitrogenous base are all that adenosine, pyrimidine, purines we have studied. And the third one is phosphate group. Yeah. So these 3 make nucleotides. Coming to the next question. The question was adverse effect of atropine includes all of the following except. What is atropine?
Anticholinergic.
Anticholinergic or antimuscarinic. So all the effects which comes through muscarinic receptors, it antagonizes those effects. Yeah. So basically, the cholinergic system, the muscarinic effects, they increase the motility. Increase the motility means they will cause diarrhea. So atropine is against them. Atropine is basically used to cure diarrhea. Okay, atropine and phenoxylate combination, they are used to cure diarrhea. So atropine causes constipation. Other than that, light sensitivity, atropine causes mydriasis, opens up the eye pupil, so it causes more like light sensitivity. And atropine inhibits the inhibitory effect of muscarinic receptors on heart. So the inhibition is inhibited now. The inhibition is inhibited means the heart is not inhibited, so it will be doing more, beating more. Beating more means tachycardia. Is this clear to everyone? What is tachycardia, bradycardia? Tachycardia, increase in heart rate. Muscarinic action, it will Stop. Yeah. Anyone wants to say something? Okay, so atropine will inhibit the secretory effect of muscarinic receptors, so it will cause dry mouth. Yeah. So the next question was the CNS and respiratory depression due to morphine overdose. Morphine overdose is doing CNS and respiratory depression, and this can be reversed by, or in simple words, what is the antidote for morphine? It's naloxone. Yeah, naloxone and morphine, they both are competitive opioid receptors. Compete with each other to occupy the opioid receptors. So only naloxone is the one which combines stronger than morphine to the opioid receptors. So it will reverse the effect of morphine. Other than this, flumazenil. Have you ever heard of this? Flumazenil. It is also
Benzodiazepine and
antidote of some. Flumazenil is antidote or antagonist of benzodiazepines. Yeah, it also binds to benzodiazepine receptors. Done. And methadone is also comes under the opioid category. Propanolol is completely different. You all know beta agonist. Yeah. Next, a basic principle of drug absorption is that drug is usually not absorbed. What is the essential condition for a drug for anything to be absorbed? Essential condition. When we can say that now this will be absorbed? When it will be in the solution form. Yeah, that's why when someone is having hypoglycemia, we just, or when we are in summers, when we are tired, we just get glucose dissolved in the water and have it to get instant energy, because we know if it is in solution form, it will be absorbed faster and we will be getting the energy faster. So the basic principle for drug absorption is that it will not get absorbed until it is in the solution. Until it is metabolized, no, it will metabolize later. Until the surface area, unless the surface area is optimal, no. How much a drug will be absorbed, this will depend on the surface area, but it is not the basic principle. And pKa is related to like where a drug will be getting absorbed, like in acidic environment or basic environment, but it is not the essential condition to be absorbed. Essential condition to be absorbed is only that drug or a molecule should be in solution form. Done. The next is nicotinic acid and gem fibrillozil. Fibrillozil are used to treat. Both of these are fibrates. You must have studied fibrates and nicotinic acid. Both of these are used as anti-lipidemic agents. Yeah, used in hyperlipidemic. Clear? If anything is not clear, you can ask. Yes, next other questions Kamar sir will be explaining. Till now, if anything is not clear, you can ask, guys.
KC ma'am, can you share the screen, because my laptop is about to, battery is very low.
Yeah,
So maybe can
sure,
you
sure,
share the
sure.
same screen? I can come from the handphone.
I will surely. Okay, there is nothing to be discussed in these 10 questions. These are clear. Can I have a yes at least?
Yes, ma'am.
Yes, ma'am.
Yes,
Thank
ma'am. Yes, ma'am.
Okay. Done. Okay, Kamar sir, I'm sharing the screen. You can continue. Thank you, guys.
Okay, yes, fine. Can you all hear me?
Yes, sir.
Yes, sir.
Yes,
Okay.
sir.
Okay. Kizia ma'am have already discussed the 10 question, and now the next question I'm going to discuss with you. The question number 11 was Which organ in the body has a major contribution to the development of the immune system? Okay, now we know that our immune system is related to the lymphoid organs, lymphocytic system, which include the lymph node, spleen, bone marrow, and the last one was thymus. If we see the other option, the pancreas are usually involved in the regulation of the insulin and glucagon. Thyroid gland, which is responsible for the regulation and contribution in the thyroid gland. And the liver has the different function in the formation of the protein, formation of the RBCs. Adrenaline is responsible for the adrenaline or balance of the hormones of adrenaline glands, which is in the kidney, on the kidney. The last option left, that's the thymus. So here the answer was the thymus because the question was the organ which has the major contribution to the development. So immune system which have the contribution because there was no other option about the lymph node. Okay, there was no option about the spleen. There was no option about the bone marrow. So these all are involved in this one. The option left was the thymus. Is it clear?
Yes, sir.
Okay. Okay, the next question was the mechanism of action of insulin glargine. Do you know that insulin glargine is it which type of the insulin? Anyone can tell me
Long acting insulin.
Yes, that's great. It's a long acting. Another class, another type of the long acting. There is only the two which comes under the
Determine.
yeah, determine. There's a two is a in type of the insulin. If you before we see the correct option, we see the other option tissue uptake of glucose. Which drug which act by the tissue uptake of glucose? If you know the other mechanism like increase insulin secretion, which drug which increase the insulin secretion? And which drug which increase the metabolism of ketone. If we know all these options, the option left was only that the blocking the absorption of glucose by intestine. These are the correct option. Tissue uptake of glucose is it metformin which increase tissue uptake of glucose. Increase insulin secretion, sulfonylurea. Sulfonylurea is the one which act by increased insulin secretion and increased metabolism of ketone precursor. That the only the drug which comes under this category is DAPI. What was the name? Wait, let me see what name of this drug. Okay, dapagliflozin. That is only the drug which comes which increase the metabolism of that one. So the option which left was the number one option. That was the correct answer. So the mechanism of action. Okay, just move to the next one. Okay, the drugs used for the treatment of bipolar disorders. So what is bipolar disorders? Anyone can tell me? Anyone want to try that? The bipolar, if you can see the bi mean that there is a two phase. One phase is the depression phase, and the phase is the mania phase. Hypomania and mania and depression. So patient having a two phase in this type of the disorders. So the most commonly drug which we use for the bipolar, we want to give the mood stabilizer. The lithium is a drug of choice. Yes, lithium is the one we do it. But the other mood stabilizer, the valproic acid, the sodium valproate, carbamazepine is also mood stabilizer, haloperidol, and lithium. These all are the mood stabilizer. Only the drug which is not the mood stabilizer, that is a paroxetine. Paroxetine is SSRI, serotonin, selective serotonin reuptake inhibitor. So that one we don't give in a bipolar disorders. So that was the question was that except the drug used for the treatment of bipolar disorder, the parox except the paroxetine, other all four options are given for the treatment of bipolar disorder. Okay, next question. Maximum dose of aspirin. I hope everyone familiar with the aspirin, right? Can anyone tell me what is the indication of the aspirin? Anyone can find an answer?
Antiplatelet.
Okay, antiplatelets. Okay, apart from that, any?
Inhibits the prostaglandin synthesis.
Okay, yes. Okay, the aspirin is the drug which have the three different effect on the three different doses. Like the different type of dosage, it show the different effect. Like low dose of aspirin, it will give the antiplatelet effect. The moderate dose of aspirin will give the analgesic antipyretic effect. And the high dose of aspirin toward the high that more than 325 up to 4 gram, it will give the action of anti-inflammatory. And apart from the more than 4 gram per day, it will give the toxicity like respiratory alkalosis, it will give the acidosis, dehydration. It more than 20, it will cause shock and coma. So usually if you see that some students say antiplatelet, some say the NSAID, that's all right. But it's all depend on the how much dose we are giving to the patient. Like for low dose, we usually give for the as antiplatelet effect for the heart patient. And analgesic antipyretic, we avoid to give it because we have the other options because we want to prevent from the toxicity that's why we have the other option that we give the 325 to 1000 milligram is it analgesic antipyretic effect and 325 to 4 gram it will give anti-inflammatory action. So the maximum dose is for aspirin is 4 gram per day. Okay, another thing you can notice that sometimes in the caps context, sometimes they ask the dose in the, they mention the option in the milligram and sometimes in the gram. So you have to take note down on these things that they just to twist the question, they change the unit instead of gram, they will put the milligram. Maybe they will write the 4000 milligram. So that one you can take note in the dosage. Okay, the next one. Okay, levodopa carbidopa is given in the ratio of. So what is the indication when we give the levodopa carbidopa? Okay,
Sir, these are antidepressant. When dopamine levels gets low in the body, then we give levodopa.
you mean to say that in depression we give the levodopa carbidopa?
Yes, sir.
And
No, sir, no, sir, sir. In Parkinson, when dopamine level gets low,
yes, we give in the
then we give
Parkinson level.
levodopa
Okay,
in
and why we
combination with
combine
carbidopa.
why we combine? Why we want to combine the carbidopa levodopa? Okay, that's correct. Yes.
Sir, because carbidopa is a decarboxylase inhibitor.
Hmm. Yes.
There's an enzyme which inhibit levodopa.
Yes, which is metabolized,
So we give,
convert
yeah,
levodopa
yes,
into
sir.
the dopamine. That's correct. The role of levodopa is the carbidopa is nothing. If we simply give the carbidopa, there will be no effect. We always combine this one because we want to prevent the enzymes which are responsible for the conversion of levodopa into dopamine. So we want to make sure that before reaching into the CNS that to avoid that conversion so that levodopa reach into that dopamine side without the conversion. So that's why we give in the ratio of 10 into 1. It means that 10 part of levodopa and 1 part of carbidopa. Always remember the levodopa is always in the high dose. Sometimes they switch, they write the carbidopa and levodopa. So you have to take note this one. The levodopa will always be higher, and usually we give into that 10 into 100 ratio also. This means that 10, for example, 10 milligram of carbidopa, 100 milligram of levodopa. in the combination ratio, or either we give the alone levodopa. But alone levodopa is not recommended, because otherwise it will do the conversion. Someone have the question why we cannot give the, actually I missed this question, and later I will explain to you. Okay, the levodopa, we can give the levodopa also, directly levodopa, but the concern is while reaching into that point to the CNS, it will be converted into the dopamine, which is the no point, no action. So we want to prevent that inhibition. So carbidopa will do that part. So that's why we always combine to give into combination of levodopa, carbidopa. And nowadays the pharmaceutical company, they already combine these together in a one dosage form to make it the more convenient for the patient as well as for the healthcare provider, so that they don't have to do it as separately. Okay, one part of this one part of that one, they already have in the one dosage form. Okay, the next one is urticaria that appears to rapidly after the ingestion of food, usually indicates the which type of hypersensitivity reaction. Do you know how many type of reactions are there?
Yes, sir. 4.
Okay. Okay. Each type of the reaction is mediated by some antibodies, right?
Yes, sir.
So the type 1 reaction is mediated by the antibodies IgE, and it is the most quicker and most the faster. And then type 2 is it the cytotoxic reaction mediated, which is by the IgE or IgM. And the type 3 is the reaction mediated by immune complex. And the type 4 is a delay one. And there are the different timing these reaction take place. The most faster is within the hour. That one is a type 1 reaction. Let's suppose if we have given any drug and the patient start having immediately within the 20 minutes, 30 minutes reaction, we say that is a type 1 hypersensitivity reaction. So here the question was that the one appears that rapidly after the ingestion of food. It can be food also, it can be the drug also, it can be any the chemicals also. If someone is exposed to any chemical, the meaning is that if the reaction occurs rapidly within the 1 hour, 20 minutes, 30 minutes, that is the type 1 hypersensitivity reaction. And usually they ask this type of the question in the hypersensitivity reaction. Sometimes they ask that how many type of the antibodies are there, and sometimes they ask that if the delay reaction of the hypersensitivity, it is a which type of the reactions. So if you know that all the types which are involved in, so you can answer it. Maybe if they twist the question, still you can answer it, get the correct or right. Okay, the next one. Okay, question number 17. A vial of epinephrine at 1 ratio 1000 weight by volume is equivalent to how many milligram of ml? Okay, if I ask you to, what does it mean, the 1 ratio 1000?
So 1 gram in 1000 ml.
Okay, yes, right. 1 gram in 1000 ml. If you see the question, they are asking how many milligram. It means that you have to convert the gram into the milligram, right? If
Yes, sir.
1 gram in 1000 ml is mean the 1000 ml have the 1000 milligram. And now the question was asked that how many milligram in per ml. If you do this calculation that 1 gram in 1000 ml, 1 gram is converted into the milligram times with the 1000 milligram in the 1000 ml, then each ml will be the 1 ml will be 1 milligram. Is it clear?
Yes, sir.
Okay. Okay. The next one. Which one of the following drug can exacerbate a patient to develop the gout? Acute gout. Okay. Now, do you know the drug which belong to which class? The acetazolamide.
Diuretic, sir.
It's used for. Let me tell you. What is the indication? I just want to know first indication. It belongs to carbonic anhydrase inhibitors. Okay. Okay. Someone have mentioned that it's used for glaucoma. Yes, that's right. And it's also used for the intracranial hypertension. Also, it we use in the heart failure. So that's fine. That's the correct. The main treatment we use for the glaucoma. And the second, colchicine. Colchicine is used for the treatment, right?
Acute gout treatment.
Yes. And the spironolactone is a diuretic. And furosemide, that is a potassium-sparing diuretic, and that one is a
Loop diuretic.
loop diuretic. So now the question is the which drug which has been exacerbate acute death. Usually the furosemide is contraindicated in a acute condition, acute gout. If the patient having a gout and if we want to treat the patient with the hypertension, so we have to select the other diuretic apart from this loop diuretic. Even the thiazide also have the some cross reactivity. It can also exacerbate. The furosemide is totally contraindicated. Thiazide is a chance whether we want to. We have to go for any other class if we want to treat for that condition. Otherwise, it will exacerbate the acute gout condition for that patient. So that one is mean is a contraindicated. The furosemide is contraindicated in the acute gout. Okay, the dose of acarbose. Do you know what is the indication of acarbose? In what condition we give this one? Okay, yes, anti-diabetic. We give in the diabetic patient type 2 diabetes. And yes, okay, yes, it's a glucosidase
Glucosidase
inhibitor.
inhibitor.
Yes, that's correct. Okay, if we see the previous old guideline that it was the first line drug during the 10, but now they have found that it had the slow action, and we give this drug combination with the other class of the drug like metformin plus sulfonylurea. We always combine in the combination, and the maximum dose this one is sometimes they ask in the 600 milligram daily, and here 300 milligram BD. The maximum is 600, and 600 milligram in a equal divided dose. Yeah, 300 milligram twice daily, and if we are available in the 100 milligrams, we can divide equally to make the maximum is the 600, but not the 600 milligram BD. It will become the 1200. It exceeds the maximum dose. Okay, the next one is atropine. Just now, Kezia ma'am also explained the atropine is the anticholinergic drug, antimuscarinic. Okay, here I have asked the atropine cause. Does it cause the constriction or dilatation?
Dilatation.
Okay, yes, it called the dilatation, mydriasis. Does it increase the motility or decrease the motility?
Decrease motility.
Yes, correct. Impairment of ejaculation is it doesn't cause impairment. Only it causes an increase in the heart rate. So this is the drug which is used in the life-saving drug when the patient having a very low heart rate. So we immediately inject the atropine also. Even we have the epinephrine also. So we also have the atropine to increase the heart rate. So this is a anticholinergic antimuscarinic drug which will cause a palpitation, which will dilate the pupil, not the constrict. It will cause the hot, dry skin. It will cause the dry mouth, thirst. It will cause the tremor. It will cause the ataxia. And the opposite of that one, that is the wrong answer for the atropine. So is it clear? Okay, I hope that you have learned something from the today's session, and from this type of the question they usually ask in context with the KAPS, and sometimes they twist the one I mentioned that the milligram or gram. You have to take note down these things. Sometimes the students they know the answer and they know yes this is the right answer. But before they getting the answer, make sure you have checked the milligram and the gram. Okay, and the second thing that sometimes when the daily dose which I have mentioned, sometimes they write in the per day. Okay, the maximum per day. Sometimes they write in the frequency like BD or TID or OD to make sure that they twist it and to make it whether the student understand the question, they know about this one. So these are the tricky part they do in the KAPS. So you have to, although it's a basic question, all the basic one, we already know the answer. Sometimes they twist the question to check their knowledge.
Okay. We can end the class today.
Okay, thank you,
Thanks.
and
Thanks.
bye to everyone.
Thank you, sir and madam.